Hello everybody, my name is Dr. Joel Bennett and I'll be talking today about creating a viable workforce. This presentation is ideal for employers, especially those who want to create a healthy workforce and also a healthy community that surrounds that workforce. The first and most important message is that health does matter, and that health and well-being is more than just physical wellness, but also includes emotional and mental well-being. And as part of that, it means preventing the misuse of alcohol, illicit drugs, and prescription drugs, because we know that when we moderate that intake of those substances, it impacts our mental and physical well-being. As part of this issue, we are seeing that 80% of the entire world's opioid supply is taken by Americans, even though we only contribute to less than 5% of the global population. There are a lot of reasons for this. But the message I want to give you today is that this is the tip of the iceberg. This is a wake-up call, and it's a wake-up call to employers as well. So let's take a look at the impact that this has to the bottom line and the ripple effect of not taking care of employees. First and foremost, when employees are not moderating their alcohol and drug intake, it impacts their ability to show up at work physically and mentally, being present at work, which is called presenteeism. These problems lead to medical claims costs and workers' compensation costs, so that impacts your bottom line. Further, it has an impact on your business culture in terms of safety, drug testing costs, and turnover, because employees are not doing well, they end up not staying with the company. But most importantly, this has an impact on the community as a whole. So here you see the ripple effect of the impact to your bottom line. Let's take a closer look at these costs. We know through societal cost estimation studies that substance misuse costs the United States roughly $700 billion annually. And you can see how this breaks down here with tobacco, alcohol, and illicit drugs. The most important fact in this slide is that a significant proportion, and it's estimated this could be anywhere from 30 to 70% of these costs, are borne by employers due to productivity, turnover, performance, absenteeism, medical claims, etc. So there are significant costs to you as an employer. For example, again, going back to the opioid issue, we know that those who abuse opioids have approximately $15,000 in higher annual health care costs. And that's an estimate. Importantly, even though help is now out there, people do not get help. It's known that only 4 to 10% of those with alcohol or drug problems actually seek treatment and get needed help. A big part of that is stigma, or fear of judgment, or being seen as less than because somebody gets help. This has also implications for attracting talent. When you have employees who are not taking care of themselves physically, emotionally, and they're also having problems with alcohol, drugs, and tobacco, you end up having a smaller pool of viable candidates because these problems impact their well-being and performance. You also have the wider impact on the community. When this starts to degrade the community, new businesses do not move into the area. What you need to think about is, what if we don't address this? What if we just leave this alone and don't do anything about it? There are many communities around the United States where they fail to do prevention, and it has really impacted the economic viability of their town and surrounding region. So the question for you: how do you, as a company, stay in business? We believe that prevention rather than treatment, or in addition to treatment, is the answer. We all know that alcohol and drug treatment can pay for itself. Study after study shows that when people go ahead, seek help, get treatment, they can return to work. If they don't return to work for you, they will return to work, and it helps the entire economic sustainability. We also know that employee assistance programs, which are free counseling benefits often offered by employers, and easy to obtain, and drug-free workplaces, when these are successful, they have improved morale and productivity, decreased absence, accidents, downtime, turnover, and theft. The research is pretty clear. Now, generally, workplaces focus less on prevention than on treatment. And we believe that the way to change this is through employer leadership. We believe that your leadership is needed. Think about it. People look up to you in the workplace and in the community. If you say prevention is important and we're going to do something about this problem before it gets to be a real problem, people will take notice, and you'll be noticed specifically as a leader in health and well-being and productivity. You have the power to drive positive change because of your role and responsibility as an employer, not only to the employees, but also to the wider community. Remember, going back to the ripple effect, by taking positive action, you'll not only reduce problems amongst your employees, but also the wider community. We have a training that we have put together called TeamAwareness. It's been called different terms in different places: Team Awareness, Team Resilience, Team Readiness. And it's a training that you have available to you that is one that can address these problems, and we're asking you to invest in this training. You'll notice on the right here that it's been recognized in the National Registry of Evidence-Based Programs and Practices, which is a Department of Health and Human Services registry. It's also recognized in the Clearinghouse for Military and Family Readiness, and it's been used by the National Guard as a flagship prevention program. It is an evidence-based program. It's been tested in clinical trials and shown to be effective, and I'll be talking about the outcomes in a moment. And it's been used successfully for more than 15 years with over 50,000 workers. And you could see here a variety of different organizations that have effectively used this team awareness training. So what is it? What does it do? It's a training that can last anywhere from 4 to 8 hours. We have shorter versions of it. But in all the various ways we've implemented it, it has the following outcomes. First, it improves the climate of the workplace, including reducing stigma that we talked about earlier, counterproductivity, and improving the overall feeling that, hey, this is a healthy workplace. It also improves employees' willingness to seek help, to utilize the Employee Assistance Program, to encourage others, including their family members and coworkers, to seek help. And it improves the responsiveness of supervisors to troubled workers. It also improves coping and resilience. It improves work stress, personal stress, and helps people be more knowledgeable about how to be effective in their coping styles, and it improves resilience or ability to bounce back from stress. Finally, and the reason that it's recognized is that it has this impact on substance use problems, including a culture and climate that supports heavy drinking. The ROI, what's the return on investment? From the calculations we've done, based on the cost of the program and the reduction in problems, you can see anywhere between $1.50 and $2.50 return on investment for employee if you pay for it. Many of the agencies in your area that are delivering this might be able to give it to you at no or very little cost because it's supported as a federal registered evidence-based program. Importantly, not every employee needs to be trained because it's a peer-to-peer program. So you can train maybe 30% of your workforce and you'll see a ripple effect to other employees. And you can see here an example of an ROI estimation tool. So why it works is because of this peer-to-peer training. You gain a high level of trust, closer connection to those you see every day. You destigmatize the reaching out that I talked about earlier. People are more willing to seek help. You get higher utilization of your employee assistance program or other benefits, coaching, counseling, even wellness program benefits as well. Employees are more likely to adhere to your drug-free workplace and other policies because these counterproductive behaviors also impact things like bullying and sexual harassment and failure to just comply with code of conduct. We also know that when you train supervisors, you receive a full benefit. So what, bottom line, are the business benefits? You become an employer of choice. You're getting much better at attracting talent because you're recognized as a good and healthy place to work. You get a better word of mouth about your company in the community, and you gain a better competitive edge as well. Importantly, the employees who have been trained to be facilitators in your community are here to provide ongoing support beyond the training. Newly trained employees have mentors who can work with them to get this message into the employee community and surrounding community. Small companies have the support that they need as well because of the grants that are available to support the dissemination of this program. And training is always customized to your company's culture and policies so that it can be integrated and used on a longer-term schedule, which has been done in a number of companies to date. Bottom line again, it's about saving dollars and about saving lives. I hope that you learned a lot today and can use this message and make a good decision. There should be links available so that you can reach out to someone locally and get the help that you need so you can take a leadership role in your community.